We have Sarah here.
Hi.
And so what we're going to try to do is rejuvenate the lower third of her face. Now, the issue is that she's lost volume in the lower third of her face, which is something that we see very commonly with aging. And with her, she has a little bit of jowling here. The fat pad has come down. There is a loss of ligamentous support in this area, and there's also some skin laxity. The other thing is that the platysma muscle doesn't attach to the bone in this area. All of those factors combine to have to give her that little jowling that she's got. So what we're trying to do is to replace the volume and give her a good definition to her jawline, but also to camouflage this jowl. And so how do we do that? So the first place we need to look is to the angle of the mandible. And so with her, over time, she used to have a better definition when she was younger to the angle of her mandible, but over time there's bony loss and fat loss and muscle loss. And so this area, this angle has lost definition, lost that kind of nice 130-degree angle that we want to see, and it's also receded medially, right? And so what we'd like to do is to create, first of all, the anchor, which is the angle of the mandible. We want to create a nice one here, thinking about where that point is going to be in 3 axes. So how on the vertical axis, how low that point's going to be, on the posterior anterior axis, where that point is going to be, not too posterior, and also on the lateral medial axis, where that point is going to be. So you don't want to project it too far out because, again, you lose that nice ratio between the intergonial and the interzygomatic distance, where for females, the intergonial distance is a little bit less than the interzygomatic distance. So preserving that oval shape to the face, we don't want to give her a square shape to the face or a rhomboid shape to the face, which is masculinizing, right? So those are the things that kind of you have to think about when creating this angle of the mandible. So after we've done that, we proceed anteriorly down the body of the mandible, creating more definition and camouflaging the jowl by filling in that post-jowl area. Then we go into the pre-jowl area, replenish the volume here, and kind of complete this camouflage here. Placement of the angle of the mandible in the vertical axis. You want to place it classically. It should be around the where the commissure is, where the oral commissure is. So if it's a horizontal line coming from the oral commissure, that should impact the angle of the mandible. It could be as low as the lower edge of the lower lip, as the inferior edge of the lower lip. But with her, we want to bring it down enough to where we get a good camouflage of the jowl. So we may cheat down just a little bit, but you don't want to make it too far down. You don't want to masculinize her face. And I think that's it. So let's go ahead. So I have my index finger on the ramus of the mandible. I have my middle finger on the body of the mandible, and so in between is the angle right here. I can feel the angle right there, so I don't want to go right on the inferior edge of it. I want to go a little bit above. Again, just because I don't want to make the angle lower than I need to. Okay, a little stick here. It's good. Okay, perfect. Okay, now I'm right on bone, injecting as I'm moving. I'm right on bone and raising a column of filler as I come up. Laterally. So now, just raising some more columns as we go. Should be numb in a sec. So I'm just raising more columns. Clench. Clench your jaw. Yeah. Relax. Clench. Okay, so right here, and I can feel it, right there is the antegonial notch. And this is where the facial artery comes up at the depth of the bone, and then comes up and out, and then takes this kind of twisty, tortuous path up to the ala, where it becomes the angular artery. on its way, it gives off the inferior label, it gives off the superior label, and other branches. It is in this area where I want to be careful about going deep, and I want to always be moving the needle out as I inject in order to be as safe as possible. Little stick here. Good. Very, very important to move constantly when you're injecting, because you really have no idea where the tip of that needle is inside the tissue. So if you're in a vessel, you're out of that vessel right away, and you're not depositing large boluses of filler inside the lumen of the vessel, which is the way that bad adverse events can occur. So already we have a nice contour here, a nice camouflage posteriorly to the jowl. Now we're using radius in this case because radius is a really nice filler for projection and a really nice filler for volumization of tissue because it has such high G prime. So radius lasts a good amount of time, anywhere from about 8 months to 12 months or more. Little stick here, and I'm just blending that angle into the cheek, just making sure to create the ramus as well. And that looks quite nice. Now radius is not reversible, and so this is a filler that really should be that really should be used by experienced injectors only. Injectors who don't have as much experience really should stick to reversible hyaluronic acid fillers. So I think it's really important to place filler into all the different planes of the tissue in order to get the most natural effect both at rest and with motion. I think you don't get as much projection if you don't place filler in all the different planes, and I think with movement you're more natural if there's filler in all the different depths of the tissue. So what I'm doing now is just blending the angle into the rest of her face to make sure there's not shadows, there's not step-offs, there's not any kind of distraction from her eyes, because we want the focus of her face to be on her eyes and not on shadows in her face. Okay, so at this point, what I'd like to do is go to the pre-jowl area, give that a little bit of volume, and then the other side. Again, for safety, I'm always moving when I'm injecting. I'm injecting small amounts, and I am injecting under low pressure. Good, and so you notice how this jowl is slowly becoming just part of a smoother jawline. I think that's looking really quite nice. So now we're done with this side. If you can see, we have a nice angle here. We have a nice body coming down here. The jowl is well camouflaged, the pre-jowl area is volumized, the chin is projected, and that blends in to the rest of the face with volumization of the marionette area. Interesting thing about radius and having a very high G prime filler like this is that it's pretty much at this point one of the only ones that you can make shapes with. So, for example, the angle of the mandible, I made this shape using radius because it has enough G prime and has enough projection it'll hold its shape. So I like that for the jawline. You need a filler that's very firm in order to do that. Softer fillers won't hold their shape, and it'll be this kind of poorly defined angle here if you use something that's soft. So let's go ahead to the other side. Go ahead. Okay, so when you go to the other side, you have to make sure that the angle on this side is placed to match the angle on the other side. So I'm going to look back and forth to make sure that this angle is good. So here's my angle, right? So horizontal, from there, it's about the edge of the lower lip. That's pretty good. Maybe a tiny bit lower, but it's okay. Cheating a little bit down is okay as long as we got good camouflage of this of the jowl. And actually now, what's interesting is that when you go to the other side, sometimes you see little things on the side you just did that you want to correct to make it a little bit more perfect. And that's, you can do that. So here. Okay, again, index finger on the ramus, middle finger on the body, in between is the angle, little stick here, up from where the angle is over here, so about a centimeter up. Diagonally from that is where I want to place my injections, knowing that this will expand the area well enough to define that angle. Now, just want to check that I'm in the right place, here and here. Yeah, that's good. Face again. Okay. Okay. So there's the angle, not too far down, not too far projected, not too far posterior, just where I want it to be. And then I also want to define the ramus a little bit. So getting around that 130-degree angle, approximately there. So that's the post-jowl area. I like doing the small injection amounts, first of all, for safety, but also for precision, and for the ultimate kind of result. Going back, adding a little bit where I need to, really shaping the area in very close detail, and getting the kind of shape that I really, really want to see. Now again, I'm blending into the cheek to make sure that I get no shadows. Good, good. So we have a little bit of swelling because I'm doing this side after I've done a right-sided lower third. There's going to be a little bit of swelling on this side that I don't want to chase after as I do this left side. So I want to do the left side where to the point of where I think it looks good, and not chase the swelling over here. Because then the risk is that I'm going to over-correct and masculinize her jaw. Okay, once again, Going now into the pre-jowl area. Small amounts, just little bits here, blending in that jowl into the rest of the jawline. Always going on the inferior aspect of the mandible, projecting that down so that we get a nice smooth pre-jowl area. Okay, so let's see here. So here's swollen. Here looks good. Just want to add, I think, a little bit to here. Right there, there's a little bit of volume loss in this area. I just want to make it blend it in so that everything's nice and smooth. Good. And check it from the other side. So I'm going, this is the area of the antigonial notch, so I want to be fairly careful, not going too deep. And the antigonial notch, you can tell where the antigonial notch is by having the patient clench, or just you can do it on yourself, and you feel a pulse on the anterior edge of the masseter at the mandibular bone. And there's a little notch that you can actually feel, and you can feel a pulse at the anterior edge of the masseter when you clench down. The other kind of guide point to where it is it's about 3 centimeters anterior from the angle of the mandible here. So here, 3 centimeters, about here. Okay, so I think that's really nice. You have good definition of the angle over here in this area. It matches this side nicely. You have good definition of the ramus, good definition of the body. You have about 130-degree angle here. This is not too low, it's not too projected. Her intragonial distance is still less than her intrazygomatic distance, so she still has an oval shape to the face. She's not too masculinized. The jowl is nicely camouflaged here, where you're looking at a more or less straight line. You can try to do better, but then in order to make this really a straighter line, I would have to project her chin down, and I think that's going to be, it's going to alter the proportions of her face, and I don't think overall it's going to be worth it. I think this is good in that it's a fairly straight line, and really quite good camouflage of the jowl here. Everything blends together well. There's no shadows, and I think this is a great result. All right, you have a big reveal. You're gonna cry?
Yeah.
I can tell. Okay, got it. Okay, so here's the front on. And then you can check
yeah.
I mean, you see
that looks really amazing.
And it's a little swollen right now. It'll come down, but you see that definition that we wanted, and you see how it's pretty straight. You're not seeing this as much anymore.
No.
It's always a little bit swollen right afterwards with radius, and it settles down quickly.
Yeah, that's good. Thank you.
Sure. So this is 6 syringes of radius. That's a good amount of filler. She's going to swallow a little bit today, tomorrow, but we can manage it using Zyrtec or something like that. This is a full correction of the area. If somebody can't afford to do 6 syringes all at once, they can do it in stages. Also, not all jawline corrections are this extensive. A lot of times there's not as much volume to replace, and so you don't need as much volume, so you need to use as much volume. But this is a good example of what a more extensive correction entails, and a good idea of what it can look like when the proper amount of filler is used.